Good morning to all. Today we are going to discuss about some oral anticoagulant agents that we are using in certain thrombotic disorders. Okay. So here we can see the first agent, that is warfarin. Warfarin is an oral anticoagulant agent which has only in vivo action, whereas heparin, which has both in vitro and in vivo action, which is used mainly as a parenteral anticoagulant. So, coming to the mechanism of action of warfarin, we know that for the synthesis of clotting factors in our body, we need certain vitamins. The main vitamin is vitamin K. So, for the conversion of inactive clotting factors such as 2, 7, 9 and 10 into activated form, we need vitamin K epoxide, and this vitamin K epoxide is reduced to vitamin K with the help of the enzyme called epoxide reductase. So, if we give warfarin to the patient, this warfarin will inhibit epoxide reductase enzyme. So, the active vitamin K epoxide will not be converted to vitamin K, and the synthesis and activation of the clotting factors thus inhibited. So, warfarin, which is a vitamin K antagonist, which competitively inhibit the vitamin K dependent clotting factors like 2, 7, 9, 10 by inhibiting epoxide reductase enzyme. So, coming to the kinetics of warfarin, the warfarin, due to its small molecular weight, it can easily crosses the placenta. Hence, the warfarin is contraindicated in pregnancy. And warfarin has slow onset and long duration of action, and warfarin therapy should be monitored by prothrombin time. Then the side effects of warfarin. We know that the main side effects of anticoagulant drugs are bleeding, thrombocytopenia. In addition to this condition, the patient may develop skin necrosis, and the warfarin show teratogenic potential. If it is given in pregnant ladies, it may cause intrauterine death or nasal bone hypoplasia of neonates. Then, coming to the overdosage of warfarin, which leads to bleeding. So, if this condition occurs, we should stop warfarin, then provide fresh blood transfusion to the patients. Okay. Then the antidote for warfarin overdosage is injection vitamin K. And rationale behind this vitamin K injection is to allow the synthesis of clotting factors. So here we can see the comparison between heparin and warfarin. Heparin is a natural source, whereas warfarin is obtained from synthetic source. Heparin has both in vitro and in vivo action, whereas warfarin show only in vivo action. The mechanism of action of heparin is to inhibit thrombin, whereas warfarin inhibit the synthesis of clotting factors such as 2, 7, 9, 10. The heparin has rapid onset and short duration of action, whereas warfarin has slow onset and long duration of action. Heparin is mainly used for the initiation of management of venous thrombosis, whereas warfarin is used for maintenance therapy in DVT. Heparin is safe in pregnancy, whereas warfarin is contraindicated in pregnancy, that is, it is teratogenic in nature. Then, heparin therapy should be monitored along with APTT, that is activated partial thromboplastin time, whereas in case of warfarin, the prothrombin time is needed to be monitored. The antidote for heparin overdosage is protamine sulfate, whereas in case of warfarin, which is vitamin K. Coming to the uses of anticoagulants, they are mainly used in thrombotic disorders such as DVT. In DVT, warfarin is used for the treatment and prophylaxis. Then, in pulmonary embolism. They prevent the extension of venous thrombus and recurrence of emboli. Initially, we can give heparin for the management, then can give warfarin for the maintenance therapy. Next, use in unstable angina, and the rationale is to prevent the myocardial infarction. Third one is myocardial infarction. In myocardial infarction, these agents which prevents the extension of thrombus. Okay. Next one is coagulants or hemostatic agents. So, coming to the coagulants, these are the agents which promote the coagulation or called the hemostatic agents. They are used mainly to prevent the bleeding. Coagulants are of two types. They are styptics or local hemostatic agents and systemic coagulants. First one is local hemostatic agents or styptics. This is the substance used to control the bleeding from local and approachable sites. They are effective on oozing surfaces like tooth socket, epistaxis and abrasions. Then, example for styptics include astringents. These are the agents which precipitate proteins and can be used on bleeding gums. Example is tannic acid. Next one is adrenaline, which is a vasoconstrictor. It will arrest the bleeding and used to prevent the bleeding from tooth socket, epistaxis. The cotton soaked in 1:10,000 solution of adrenaline is mainly used for this purpose. Next one is thrombin powder, which is obtained from bovine plasma, dusted over the bleeding surface, especially following skin grafting. Next one is fibrin, which is obtained from human plasma, which is available as sheets used for covering or packing the bleeding surfaces. Next one is gelatin foam. The gelatin foam will provide a meshwork and which will activate the coagulation pathway. Next one is systemic coagulants. They are vitamin K and ethamsalate. So first one is vitamin K, which is essential for the biosynthesis of clotting factors. Vitamin K, one preparation is available in oral, subcutaneous, intramuscular and intravenous route. The vitamin K deficiency can cause what? Severe bleeding. The uses of vitamin K preparations, mainly in vitamin K deficiency and routine to all neonates to prevent the hemorrhagic diseases in newborn. And also vitamin K preparations are used for warfarin overdose. Then ADR of vitamin include anaphylactic reactions, jaundice, severe pain and swelling at the injection site. Next one is ethamsalate, which is used orally. The mechanism of action behind ethamsalate is stabilizes the vessels and reduces the capillary bleeding by inhibiting prostaglandin I2, which is an antiplatelet prostaglandin. Uses of ethamsalate to control the bleeding after dental extraction procedures, and also which is used in menorrhea and postpartum hemorrhage. Okay, so hope you will understand. Thank you.